I welcome all of you to this session. So there are facts. Example. Facts are, say we have 12 meridians. 12 meridians. It is a fact. Now, how many of you got this question when you were, I'm assuming all of you have completed your first semester, or you know the fundamentals of traditional Chinese medicine, right? So when you were taught that there are 12 meridians in the body and plus 2 vessels, okay, conception vessel and governing vessel. How many of you got this question in your mind? Why only 12 meridians? Why not 13, 17, or 10, or 9? Why 12 meridians? How many of you got this question? So less than 10% or less than 5% of the people got this question. What about the 95%? Many of us did not even get this question. Do you think it is people should get this question? Should they get this question? Why 12?
Yes.
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 Right. So
because we have 12 organs, 6 yin and 6 yang. So we have 12 meridians. I thought
why there are only 12 organs?
12 systems, sir. We have 12 systems.
Why 12 systems? Why not 15 systems?
Hours of the day, sir.
Because of 5 elements,
Hours
5 elements
of the day.
as 6 energies. So
my question is, why 6 energies? Why not more? Or why not less? So this is a fact. And for someone to create this fact, there is a philosophy behind it. Or there is a philosophy or a science behind that fact. So, for example, I'll give you something very simple. This 12, how many months do we have in a year?
12 months.
So this 12 and this 12, do you think there is some connection?
Might. We don't know. Might be, we don't know.
Might be. Yeah. But I'm trying to create that thought in your mind. Why 12? There is something happening over there. Okay, 12 months. Okay. So there is a science. Why only 12 months? Why not 13 months or 10 months in a year? Why? In your kindergarten or in your primary school, when you are studying and the teacher told you there are 12 months in a year, Jan to December. So how many of us?
That's because of the moon cycle.
Okay. Yes.
Season, based on seasons. Based on seasons, sir.
Okay.
4 seasons are there, per season 3 months.
For balance also.
Is it something
So once
similar
again,
to like
once
for
again,
us we say seven colors in a rainbow, similarly something connected like that. 12 in China they had something connected with 12.
So it is something related to
solar and molar.
Our
Our nature.
our solar system. And there is moon. The movement of the earth, the movement of the moon. So the movement of the earth around the sun and the movement of the moon around the earth, there is a reason behind that. There is a how this solar system is created that influences the bodies. The year, that is the number of months, and that also influences the number of meridians in the body. Do we also see some correlation? Our menstrual cycle in female is how many days?
28 days.
28 days, sir.
28.
And how much time does the
Moon.
moon require to move
3 to 4.
around the earth?
28
Around
days,
29
sir.
days, sir.
Approximate.
29 days.
Approximate. So do you see a link between the movement of the moon and the duration of the menstrual cycle in women? Are you seeing?
Yes, sir.
So
Yes, sir.
there is these facts which are being told or which we have learned. Okay, this is the number of meridians. This meridian has these many points. All of that are facts. Say heart meridian has nine points. Heart has 9 points. And urinary bladder has
67 points.
67 points.
67 points.
why is it so? Why such a stark difference? Is heart less important than urinary bladder? That is why heart has less points?
Because it's yin.
It is due to
closer
the kidney
to-
essence, because that kidney essence is to be distributed to throughout the body, whereas the heart is only for the limited purpose.
Why not heart distribute the kidney essence to all the organs? Why kidney or urinary bladder?
Because the location of essence is in kidney, and kidney and urinary bladder are related.
Why location of the essence is in kidney? Why can't it be in heart?
So maybe because water is a good distributor, but you can also ask why wind is not a distributor. But
Heart circulates blood
yes,
to all
yes.
cells. So you keep the essence in the heart itself. Why in kidney? Is the question making sense?
Yes, sir,
Question is
definitely.
making more sense and more curious.
So does it mean heart is less important than urinary? Urinary bladder is what? It is just a pouch of muscle where the wastewater of the body collects. Isn't it? It is just a collection of pouch which collects wastewater of the body. But Heart. See, if somebody does not have a urinary bladder in the body, will they be able to survive? If somebody does not have urinary bladder in the body, if it is removed, will they be able to survive?
No.
Why?
No.
Yes,
Why?
sir.
Why?
They can
No.
survive, but they have to have that catheter and removal system, sir, in their body attached.
Huh. So they can survive. It is not mandatory. But if somebody's heart is removed, will they be able to survive?
No,
Not
sir.
at all.
No.
Not.
Right? So it is of phenomenal uh, importance. Heart is of phenomenal importance. It circulates blood throughout the body. The question is, why only 9 points to heart and 67 points to urinary bladder?
So maybe because urinary bladder runs from the toe to the head.
Why not heart run toe to the head?
Because
So due to gravitational pull, maybe heart is upper side, and when it gives a pressure, it goes fluently. The blood flows fluently uh, throughout the body. But against the gravitational force, the toxic things or all comes up to the heart, isn't it? So maybe that reason.
How many of you think that is a strong reason?
So previously we've been discussing that like heart is the emperor and emperor does very little work, and urinary bladder is like one of the subjects or labors of the body. So the labor does more work, but the emperor takes the most decisions, like the CEO of the company. Like, but still it does not answer why only 9. It can be also 4 or 5, but why less and why more points? This is one of the reasons that we discussed.
Very good. So we had discussed this in some other class. See, heart in TCM, it is told heart is the emperor, right? And urinary bladder is like a servant. So for that, we will have to understand the concept of yin and yang. I am not teaching the subject. I'm only trying to teach you how the classes will be. Like, how do we take up different aspects of concepts of the TCM. Somebody has to be an emperor, right? So the question is why heart is emperor. Somebody has to be emperor, and we will get to know. So imagine there is an object. The outer you go, it is yang. And the inner you go, it is yin. Okay. So I am assuming that you all know the basics of yin and yang. That is why I am not going into the details of this. Okay. Just give me a moment. Now a meridian flows, and the meridian flows. Does it flow only on the outer side or also on the inner side? So
Both sides.
the
both
meridian
sides.
flows on both the side. So imagine that the meridian is flowing like this. Okay, I'll redraw it. In an ideal condition, or like let us divide it into half. So Outside it flows half, and then inside it flows half. Imagine. But this is not the condition, right? There is no exact half yin, half yang. So it is, all of them are either more yin, more yang, right? And as a combination of different yin and yang, there is a balance of yin and yang. So now I will draw. So imagine there is an organ, the yin meridian. The yin meridian will flow more. Where? On the inside or the yang side?
Inside.
Inside.
The yin meridian will flow more on the inside, right? So this is equal 50%, but it will flow more than 50%. And then the remaining, it will come and flow on the yang side, right? So this is the black is the yin meridian. If it is a yang meridian, how will it flow? Where will it flow more?
The yang side.
The yang side.
Yeah, outside.
Yang side.
So a yang meridian will flow more on the yang side.
Yang side.
I will just write this. So this is 50%, and it will flow more than 50% on the yang side. And then the remaining, it will flow on the yin side. Making sense? This is a yang meridian. Is it up to this point? It is clear. The yin meridian flows deeper in the body more, and the yang meridian flows on the outer side more.
Yes.
Clear? Now, the points that we see in the chart, right? Heart meridian flows from here to here. This is what, this is the meridian, say if this is our skin. If this is the skin. So the meridian flows just below the skin, and it will, for some distance, it will flow very close to the surface, and after some time it will go deeper in the body. So this is the deeper in the body. And the acupoints that we have is very close to the surface. So imagine, and these we use to do the acupuncture, to put needles. Imagine we are putting the needles. So if it is very close to the surface of the skin, I can stimulate the point using the acupuncture needles. Now, if it is in the deep part of the body, can I reach the needle?
No.
I cannot reach. Even if I use long needles. Will I be able to reach all points? Say this is so deep. I will not be able to reach the points. So, the points which are shown in the chart are only the surface level. The deeper part are not generally shown. are not generally shown because it cannot be used, right? So when we say the heart has 9 points, so the surface level is 9. And for urinary bladder, surface level is 67. So this is yang. Urinary bladder is a yang organ and heart is a yin organ. Okay. Now the yang organ will be obviously more because it is on the surface. Yang will run more on the surface. So there are more acupoints in. If you see the chart of all the meridians, the yang meridian will always have a higher number of acupoints compared to its yin meridian, right? Heart and small intestine. Small intestine will always have a higher number of acupoints in comparison to heart. Kidney and urinary bladder. Urinary bladder will have a higher number of points than kidney. Okay. So now heart has lesser on the surface and more in depth. Urinary bladder has more on surface and less in depth. Right? Up to this part, it is clear?
Yes, sir.
Now, heart is the emperor. Heart is the emperor. And urinary bladder is servant. Both the emperor and the servant will have the same amount of time, 24 hours per day. Just because emperor, no, he won't get extra time. Now, who will spend more time in deep type of work, strategic thinking? How should I allocate resources to the kingdom? How should I protect my country against the invading army? How should I run the taxation system? How should be the justice system of the country? What should be the policies for the agriculture? Like these are all deep kind of intellectual work. Who does it more, the emperor or the servant?
Servant.
Emperor.
The
emperor. The emperor.
The emperor.
Emperor will do deep work.
Yes.
Intellectual. Deep is intellectual work. And surface work, superficial, means ironing the clothes, cooking the meal, cleaning the room. Say if somebody is, say the emperor will be wearing a cloth, right? So will he do the washing and ironing of the cloth? Because it is surface level work, easy work. He has been posted as king because he has to do something very deep and not superficial work. So he will do less superficial work, right? So he just has to tell, okay, get me a tea. Somebody will make and bring it, right? So he will do more deep work and less surface work. Whereas a servant, will he do the deep work or surface work? Will he strategize the policy for
Surface work.
foreign?
Surface work.
Surface works.
He will do less of surface work, means he will do less of deep work, and he will do
And
more.
more of surface work.
When he is told, okay, clean the palace, the whole day he will be sitting and cleaning the palace. So he will be doing more of the surface work. The king will not do too much of surface work. So the meridian for heart is less on the surface, right? The acupoint are so less on the surface and more in the deep for heart, right? And for urinary bladder, so there is more on the surface and less in the depth. The heart, the emperor has to do more deeper things. So the meridian is more internally, and the urinary bladder has to do more on the outer part, that is surface cleaning part, etc., etc. Send the essence, distribute the essence, etc. So that is why the urinary bladder has more on the outside and less on the inside. That is why there is less acupoints in acupoints are only on the outer surface in the heart, and there is more on the urinary bladder. Does it make sense?
Yes.
So there is a fact, heart is 9, UB 67, but there is a philosophy behind the facts and science behind the facts. And the attention or this book teaches us on the philosophy behind the facts. And this is what we will be aiming to learn more deeper parts of the science, the TCM science. Is it making sense what we will be learning?
Yes,
sir.
sir.
Yes,
Interesting.
Yes, sir.
Mhm.
Yes.
Yes,
Anybody,
sir.
anybody has any question? What will we be learning? Hmm? Like this is just, I'm taking one example. Okay, there are hundreds and hundreds and hundreds of things which are there. Okay.
Sir, it means each and every organ will have the same number of points in total. Is it something like that?
You can consider it to be like that. Say both, say there are two meridians, yin and yang. And but which will have, so the yin will be, so if I say deep and surface, so the yin will be deep more and surface less. Yang will be less in the deep, more in the surface. If you see the yin and yang symbol, you see the yin and yang. How is it written? The yin and yang. So this is yin. The way that it is distributed, the yin part and yang part, it is 50% and 50%. Is it so, or is it other way? Is the distribution between the white and the black part, is it 50% or 50-50 or more or less?
No, sir.
50,
No,
50.
sir.
The total amount of black area and the total amount of the white area, is it same or different?
They are equal. They are equal.
It is same.
Equal.
In an
Equal.
ideal
Equal.
case, it should be equal.
Yes.
Equal, sir.
So we are talking about the ideal. Okay. So it is 50-50. So, but the way that it is presented is different. Deeper will be more for yin and surface will be more for yang.
Yeah.
Right. There is no, the yin and yang is supposed to be what? Equal in the creation and in the body. Right? Or is it to be unequal?
No, equal.
Equal. Right? And the further subdivision of these things, we will discuss it later. This is a very beautiful quote from Ling Shu. I'll read it. It is by virtue of the 12 channels that human life exists, that diseases arise, that human beings can be treated and illness cured. The 12 channels are where beginners start and masters end. To the beginners, it seems easy. The masters know how difficult it is. Especially the second statement is phenomenal. So the beginners start from the meridians, like 12 channels. Oh, this organ, this meridian has these many points. This is the path of this meridian. Like those are all beginner parts. And the masters end at the meridian. And the masters will get to know why this organ's path is like this. The meridian shifts its path. Why? At this junction, it shifts the path. Why? And this is the path, like why only small finger for heart meridian to end? Why not thumb? Why not middle finger, or any, for that matter, any place? Why not heart flowing in the heart meridian flowing in the leg? Why only in the hand? And why only 9 points? Why not 19 points or 5 points? Masters, after spending their entire life or multiple lifetimes, finally they will go and realize, oh, why? This is the reason why it has only 9 points, or this is the reason why it flows like this only, and it is making this change in the course of its path. So the masters will end the meridian. So now, are we starting our journey or ending the journey?
Starting, sir.
Starting.
Starting.
So we'll start as we'll take baby steps, deeper and deeper and deeper and deeper, slowly, 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 little by little. Okay. We will try to expand our boundaries of thinking with the help of this fantastic book called The Yellow Emperor's Classic of Medicine. Okay. So it has about, like, it has 81 chapters. Like this Yellow Emperor, it's also called Neijing. Okay, Neijing. So this has two parts. This Yellow Emperor is called Neijing. It has two types, two type of books. One is Suwen. Other one is Lingshu. Okay. This Suwen discusses about the concepts. And the Lingshu discusses more about techniques of treatment. Techniques of treatment. So we will be studying Suwen and not the Lingshu. Okay, which point to use acupuncture, which point to use moxibustion, which direction, what depth, those kind of contents are given in Lingshu, and more of conceptual things are given in Suwen, and this has 81 chapters, and we will be going through the 81 chapters of Suwen. Clear? So this book, it is about anywhere between 1,200 to 1,500, around that price range. It is available in Amazon. Those who are interested, you can buy it. Okay. Once again, it is a dialogue. It is a Yellow Emperor's Classics of Medicine. So we'll be discussing Suwen. So this is a dialogue between two people. Two people are having a conversation. So as Ravindra sir told, say, for example, we have, say, Bhagavad Gita. It is a conversation between two people. One is asking a question and the other one is answering that question, right? Conversation between Arjun and Krishna. So the Arjun asks a question. Bhagavad Gita, it is wrote, Arjuna Vacha, like Evam Satata Yukta E Bhaktan Tvam Paripasate. Like in that way it starts. Arjuna asks a question. And in response, Krishna answers. It says Bhagavanu Vacha. So Arjuna Vacha, Bhagavanu Vacha. Arjuna Vacha, Bhagavanu Vacha. So one person asks a question and the other person gives an answer. One person asks a question and the other person asks a counter question to answer that question. So in this way, there is a dialogue going on and it gets into the depth of these philosophies. And similarly, Akbar Birbal, a dialogue between them. Krishna Devaraya Talani Ramakrishna. Right? So here it is a dialogue between Wang Di and Shibu. Wang Di is the and Chibo is the court physician. In Hindi, we are no, India we say Raja Vaidya, right? So he is the court physician. So Raja Vaidya is, they select the best of the best to that position, right? Not any ordinary physician will be taken. So court physician is the best of the best in that kingdom. So you see, this person, Wang Di, is a semi-mythical figure, okay, where there are a lot of lores. Like he was a born prodigy, and he was brilliant, and he was the one who kind of established the Chinese like modern way of civilization, right? And he built many systems which continues in the Chinese culture. So he asks questions. And his court physician, Chibo, gives answers to those questions. And these question answers are compiled in the book Yellow Emperor's Classic of Medicine. So why is he called Yellow Emperor? Is because he had some disease which made his skin yellowish. So that is why he's called Yellow Emperor. Okay. Okay, I'll read the 81 chapters, the name of the 81 chapters, just for you to get a feel of what the name of the topics are. Okay. Okay. So these are the name of the topics. 8 are different chapters. The universal truth, the art of life through the 4 seasons, the union of heaven and human being. How is the heaven connected to the human being? And how is the 4 seasons connected to this life? Okay. The truth from the golden chamber, the manifestation of yin and yang from macrocosm to the microcosm. How is yin and yang related in the macrocosm? Yata Brahmande Tata Pinde. We have learned this. Brahmand, how is this connected to the pind? Okay, that is microcosm. And what is the way that yin and yang interact? When does yin does something, and in response, what will the yang do? And if yang initiates something, and in response, how will the yin do? How much will the yin does the work, and how much will the yang do? Like this kind of, how will the interplay? Like husband and wife. What work the husband does, what work the wife does. When does the husband take over the work of the wife, and when will the wife take over the work of the husband, etc., etc. All that complex interplay of yin and yang. And the further discourse on this yin and yang, the sacred teachings, the energetic cycles of the universe and their effects on human beings. So we know the universe through its physical form, but through its energetic form. How do we understand the universe and how does that affect the human beings? Dysfunction of 5 Zhang visceras and the further discourse on this 5 Zhang visceras and what are the methods to be used for the treatment and how do we treat the mind and how do we treat the body and what should be the art followed while giving medicine. So the Ayurveda has one way of describing how to give medicine and the TCM has another way. And doctrines of the jade tablet, diagnostic importance of discussion of the collapse of the meridian. When does the meridian collapse? What are its symptoms? And how do we treat it? The method of pulse examination. How do we examine the pulse? We will not go into the depth of the pulse because it is a very big chapter by itself. So we will understand the fundamentals of the pulse examination, pulse analysis, seasonal variations and abnormalities in pulses. When the seasons are varying, how will the pulse vary? And what are the different types of abnormalities in the pulses? Determining life and death. When you see a patient, how do you see his time is coming close or he still has a long time to go? Determining life and death. Meridian pathology and corresponding pulse signs. If there is some kind of pathological imbalance in certain meridian, how does it translate in the signs of its pulse? Seasonal organ pathology. In one certain season, certain type of pathology comes in a certain organ. What are the details of it? Paradigm of 5 elemental phases. Channel constituents and acupuncture techniques. Okay, what type of constituents are there in different types of channels and how do you use acupuncture for them? The preservation of health. What should you do? What to preserve your health? Acupuncture in accordance with cosmic cycle. So how do I treat based on the cosmic cycle? Either it could be in a simplistic form based on the seasons or at a bigger thing. Like we can use certain times, there is more energy in certain meridian. How to use those time or seasons or something even bigger. Pathogens, what are the different types of pathogens? The nature of excess and deficiency. If something increases, what else can decrease? If something decreases, what all can increase? In what ratio? Like it has its own complexities. No, it is a very big subject. Excess and deficiency, we will understand that. Discourse on Yin Yang Ming channels. Somebody was referring to it. And disorders of Yang Ming channels. Discussion on febrile disease, that is, which creates high temperature in the body. Acupuncture. How do we use acupuncture to treat febrile diseases? A discourse on Wenbing and different types of imbalances, how to treat malaria-like illnesses, and the acupuncture treatment of malaria. Pathologic disorders of heat and cold. When there is an imbalance of heat and cold, what are the signs which comes? How do we treat it? Etiology, diagnosis and treatment of cold. For cold, how do we diagnose and treat? Differentiation of pain. What are the different types of pain and what are the signs of each of these pain and how do we treat it? Conditions of abdomen. What are the common conditions which we see in the abdomen problem and how, and acupuncture in treatment of back pain. Pathology of wind, what are the different types of wind imbalances which can happen? And the bi syndrome, V conditions, J conditions, normal and abnormal course of illness, unusual illness, extraordinary illness, channel pathology in accordance with energy almanac, rudiments of acupuncture, needling depth in acupuncture, contraindications in acupuncture, which are the points to be acupunctured and which are the points not to be acupunctured, and certain times when it should not be acupunctured and certain times when it can be acupunctured, those kind of things. Principles of tonification and sedation in acupuncture. When do we tonify? When do we sedate? The art of acupuncture, acupuncture techniques, dermatomes of the channels and collaterals, different types of, there are meridian and collaterals, meridians, acupuncture points, pathway of channels, acupoints along skeletal indentations, like how does it flow based on the indentations of the skeleton, that is the bone. Acupuncture treatment in water and febrile diseases. Regulation of channels, acupuncture of superficial lu connecting points, acupuncture according to the seasons. When does the patient come to your clinic? Is he coming in summer or winter or fall, or how do we treat in based on those seasons? Bio and Ben and transmission of disease. How does the disease get transmitted? Energy almanac, the 5-phase circuits, the 6 atmospheric influences, effects of 5 elemental phases and 6 atmospheric influences, the rules of phase energetics, the 6 macrocosmic influences, acupuncture in epidemiology, etiology of a disease, essentials of disease and therapy, the yellow emperor on pathology, the importance of correct diagnosis. If you are not correct, pinpoint accuracy in diagnosis. The 5 failing of physicians. Why do physicians generally make mistakes or they fail? The 4 lapses of physicians. The 3 yin and 3 yang channels in the human body. Growth and decline of energy. How does the energy grow? And in what age it grows? And in what percentage does it decline? And in what age it declines, in what state, and which energy declines? And subtle reasoning. Why is this happening? There is gross reasoning and there is subtle reasoning. So how do I come up with subtle reasoning for what happens in the body? How is the list? Huh? How is the
Very
Very
deep,
good.
sir. It feels like
We
probably
have gone out.
we yeah, something we never think. It is so vast.
So much to learn.
It is, the depth is phenomenal. How much time do you think we need to cover? So to cover a question, simple question, why heart has 9 and why urinary bladder has 67? And we answered only a tiny part of it. And we took how much time? Probably 45 minutes, 30 minutes, 45 minutes for a very small question. Now imagine the depth of the topics. Huh? How much time do we think we will need? 1 hour per chapter, do you think it is sufficient?
No, no, sir.
No, even if we take one one chapter, 1 hour, we will require 81 hours. So in one day, if I cover 2 chapters, I will still require 40 days, 41 days. Okay, 41 days is more than a month. Okay. And I am assuming if you don't ask any cross questions, etc., I will be able to, right? I'll give you, say, for example, in terms of channels. That is, like, there are 12 meridians. We have to discuss the 12 meridians. And each meridian, the book discusses in, like, say, 1 paragraph or 2 paragraph max. But I'll give you an example. Okay. So we are seeing the stomach meridian. Now, the question, when you are seeing this stomach meridian, okay, only observe this. This figure provides the outer part of the meridian. Okay, the acupoints, but this picture provides the inner flow of the meridian also, how it is flowing through stomach, the internal part also. When you see this picture, what comes to your mind? When you see this picture, what comes to your mind? It can come, anything can come. Who wants to say?
So how the meridian is connecting like stomach and spleen. Usually, when we just see these 45 points, we don't see the connection between stomach and spleen. But right now, when we are seeing the new picture, here we can see that the inner meridians, they are like sort of connecting stomach and spleen together, like husband thing.
Okay, she is talking about this. This is spleen and this is stomach, and there is a meridian which is connecting, the internal meridian which is connecting it. Okay, good. What else?
Though the
The
stomach
pitch.
meridian, it passes through many organs, which covers the like full,
Yes.
almost the vertical part of the body.
Okay, fine. What else?
Why it flows only in that pathway? Why can't it choose in another way? Why only that way?
Okay, what else?
Is covering our most of the sense organs also, no?
Yeah, very good. What else?
Actually, stomach and spleen part covers few points. Other body parts has more points.
Okay, fine. Only this part, only few points are there where the organ is.
Yes.
But the meridian is covering so many other parts of the body, areas of the body. Okay, and what else?
This clears that we can use a single meridian for different purposes, for different diseases.
Okay, fine. So stomach meridian is not only for stomach problems, it can be
Yes.
for other problems also.
Yes, yes.
Okay.
Yes.
And
So like the connection between of REN 13 and REN 12, the way it's written meets with the conception vessel at REN 13 and REN 12. So this is how it is connecting. The stomach channel is connecting to the REN channel.
okay. Fine. See, there are hundreds of things which can be thought of. But what I thought today when I was just seeing this is so the meridian starts as one path from the finger. Sorry, like no, at one end. So it is just one line going up. Okay.
Yes.
It starts from the eyes. Okay. So it is just one line which is going, and suddenly it shifts, it splits into two in the face area. So here, so you see it, one is going to the brain and other one is going to the eyes. Why should a stomach meridian connect to the eye?
It
So,
is
Since
starting from the eyes,
yeah,
no?
yeah, it
So
is. I am telling.
basically, I am thinking the previous meridian has ended, the large intestine meridian ended at the nose, and from there must be an internal channel that is continuing to the stomach
See,
up from the eyes.
what it is ending here. So it can,
Always.
Since
it
eye
can,
is a
see,
sense organ,
see, it can,
while taking the food, the eye has to see the food, it should attract so to get the food energy.
Mhm. Okay.
Normally,
Close.
a meridian when ends, nearby itself, the another meridian starts. Because the energy goes from the end of first meridian, goes to the second meridian to start.
Okay. See, large intestine ends here. The stomach could have started from here on the cheek. It is also near only, right? Why is it starting from the eyes? It could have started from here or here or here or anywhere. Why eye? Hmm? Is it
It
a
is the
valid question?
opening.
Is it a valid question?
Yes, it is.
Okay, why? And this is what?
It's an
This is
opening, one opening of the body,
no.
Sir,
Like does all the meridians start at an opening or end at an opening?
No.
Right? Then why? Yeah, go ahead.
One sense organ to another sense organs.
So
yes,
all
sir. Sense organs are, I think, sir, because LI ended at near nose. So stomach started from the eyes.
that is the question that I am posing. If it is ending it here, it has to start somewhere nearby. It can start here, anywhere.
Another
Why?
sense organ, sir. Another sense organs, eyes, sir. Nose and eyes.
It could have started from mouth. Why eyes?
The mouth, the tongue starts salivating when we see food, or at least when we visualize food. Maybe that is why God made it that way, that there is a connection from eyes to the stomach.
Yes, very interesting. Close, very close. Okay, imagine that you are a host, like you have a house. You want some guests coming to your house unannounced or with pre-notification. Say some 10 guests come to your house. They just ring the bell and just they come. You want them to come like this or no advanced notice? They tell,
Yes,
okay,
advance.
they'll be coming.
Better advance notice.
Better with prior notice.
Yeah, you want it to be in prior notice, right? So similarly,
There can be another reason.
hold on,
I
hold
think.
on, hold on.
For the stomach to prepare the digestive juice, and also for the pancreas to secrete insulin. The sight also should be there. The smells also should be there of the food. Then when we see the food and when we smell the food, the digestive juices can be produced easily.
Very good. So we are coming close.
That can be one reason.
Okay. So this is not a right. Good. Okay.
That's why if we smell good smell of food, or if you see beautifully decorated food item, our mouth will water, so that the digestive juice can be prepared in the stomach as well as in the mouth.
Okay. Who consumes the food first? Who
Mouth,
consumes?
eyes.
Eyes.
The mind consumes the food first.
Mind.
Right?
The brain.
You
The
first
brain.
eat in the mind. You see,
Yeah.
you feel,
Yes.
you want.
Yes.
You consume the food in the mind first.
Mind first. Correct.
And then into the stomach.
Stomach.
So it is when you see the food. What happens first? I'm writing it as a brain. I can't write the mind, right?
Yeah.
So I can only write the brain.
Only write brain.
So what happens? The mind first thinks. So that is why if you see the meridian, there is one connection going to the head. Brain, stomach 8.
Yes.
Your brain is first consuming.
Yes.
By seeing.
Looking. By seeing.
So there should be some connection between the eyes and the brain. And smell, it is passing close to the nose. And you eat by what? You eat through the mouth. So it is also coming to the mouth. Eyes, nose,
Saliva.
mouth,
Saliva also produces.
and the brain. Right? All of these three things are interplaying.
Yes.
So when you see, it is a pre-notification that your guests are coming. The guests are coming. So the host can prepare for the guest. Right? The host can prepare for the guest. So now there is a signal. And that also connects the, I will write it in a different way. So the eyes, nose, and the mouth, and the brain, and then it connects to the stomach, and there is spleen. So this is stomach and this is spleen. Okay. So it connects these two organs, then continues. So you see the food and you want to eat the food. So what you have to do, you have to move towards the food. The meridian continues to the feet. Making sense?
Yes.
Is this 100% complete information of why the meridian is like this? I am not telling you how the meridian is flowing. I am telling you why the meridian is flowing like this. Probably 1%, 2% of the entire reason why the creator created that meridian like that. Right? There can be hundreds of other more interesting reasons. So to cover one meridian in a reasonable way, for you to understand the reasoning behind it, so much is the explanation. And imagine how much data it is. That book is touching upon so much of data. So from tomorrow we will take up the chapters. So today was just an introduction, and this I want to give some like how these masters were able to come up with these things. Okay, it is see, in anything that we take, there is both visible and invisible. Invisible. Okay, there is both visible and, so if there is anything, so there is both visible and so we have a, say, cell phone. Okay, we have a cell phone. So it has two things: the visible part, which is the handset, and the network, which is invisible. So can the phone work without the network? No.
No.
So the visible
No, sir.
cannot function fully without the help of the invisible.
Invisible.
Right? So for something to work fully, properly, both visible and the invisible is needed for any object to work. Visible is something which follows a certain logic, like say laws of physics. Say it follows how do I put it? Certain physical laws. And the invisible also follows certain laws. It is invisible follows certain non-physical laws. Okay. This visible part is easier. It is easier to understand. And this is more complex and difficult to understand. Okay. So visible, I am using the word easier and not easy because understanding physical also is quite complex, right? Like if you want to understand the cell, how it functions, it is not easy. It is phenomenally complex. Even though it is visible in a microscope, like we can't understand everything. So even to understand what is visible, it is not easy. Then to understand the invisible, it is much more complex. So it is, which is easier to change, the invisible or the visible?
Visible.
Visible, sir.
What is easier to change, the invisible or the visible?
Visible, sir.
Why? Why? See, now this is a handset. So it is a visible part. Now, is it easy to change this or easy to change the network? Like you have already built it, made it.
Yeah. Easy
Right?
to change the network.
So it is tough to change the visible.
Yes.
But easier to change the invisible. Is it correct? What I'm telling, is it correct?
Right.
Huh? So,
Sir, how
see,
we can know that the invisible is changing or not?
assume, say there is certain degree of network, okay, 4 bar. So from changing from 4 bar to 3 bar, is that easier, or making this rectangle into circle, is that easier?
course, in this case, it will be the invisible self, which is said.
Difficult only.
So,
Changing the network is easier.
so changing the invisible is the easier part.
Easier.
Changing is difficult. Changing is because it is not concretized. The invisible is not concretized. The visible is concretized. Right? Say, I'll take another example. So body is visible. The mind is
invisible.
Invisible. What is easier to change?
Visible. Body.
Body changing body is easier, changing mind is easier.
Changing mind is easier, sir.
Huh? Say you did not want to eat the say that fried item. That was the mind with which you went. I will not eat any junk food. But after seeing the food, the mind changed and you ate it. So the mind changed like this. And now after eating the junk food, the fat went and collected in the abdomen. Now, how difficult or easy is it to change the fat?
Very difficult.
So mind change like this, but to change the fat, it will take a lot of time and effort. So the invisible is easy to change. And to change the visible is more difficult. It takes energy. So now the body has both visible and invisible. Body has visible and invisible, the energy, the chi which is flowing in the meridians. So if I have to bring a change in a patient, what is that I have to change first?
Mind. Mind has to be changed.
What is that I have to change?
Mind has to be changed.
Mind or the chi? Chi is also invisible, right? Which is flowing in the meridians. So if I change the chi, which is so much more easier than changing the body, so the invisible has an effect on the visible. So that is why in acupuncture or acupressure, we don't try to change the physical. We just change the invisible and the visible will automatically get changed. Right? And to understand this invisible, it is tough. To understand the invisible is tough. So these ancient great masters, they had this deep intuitive ability. They had lot of penance, tapasya, meditation. With that, they had acquired the ability to understand the invisible. It is the intuition. Intuition to understand the invisible. By the masters. So with this, they mapped the meridians. They mapped the acupoints along with intuition and plenty of observation. And intuition plus observation plus experiments. So these intuitions, phenomenal amount of observations and experiments, they came up with the PCM. And in the modern visible part, it is instruments plus observations plus so in the ancient science, the instrument is replaced by intuition.
Intuition.
They have phenomenal amount of intuition. And that is why they were able to understand the invisible. And in a silver platter, they have told us this is how the invisible works. And when you stimulate these points, these invisible things happen. Okay. And from this invisible, the visible things happen. Okay. So this is the way that the ancient masters functioned. Okay.
Sir, in what way it will be helpful for beginners, sir?
See, now you have understood this. And now, after understanding this, you attend your semester classes, SEM 2, 3, 4, 5, etc. What do you think will be your ability to absorb the content of the future semesters in comparison to some other student who has not done this course? It will be significantly high. You will be able to absorb so much more.
Okay.
And
the vision will be increased like anything, sir.
yeah. And
The understanding of the semester topics will make us easier, very easier to understand.
much easier. And irrespective of what you learn or don't learn, but you will learn one thing, that is how to ask good questions, because the entire subject is on a question and answer mode, right? The Huangdi is asking a question and Chibo is giving an answer, and apart from that, I am asking so many questions to you guys, and you will be asking so many questions to me. So what will the entire class learn? How to ask good questions, and how important is that ability to have? How important is that ability? It will help your entire life. That ability that you learn on how to ask good questions, like probing questions, like which penetrates, that will help you. Either you are learning a subject or having an argument with someone in the house, right? It will be very helpful. Yes, sir. I'll hand over to Ravindra, sir.
Yeah. Friends, Krishnamurti is a product of Indian Institute of Management, Lucknow. Okay, as he said earlier in the day, what is the superficial learning and deep learning, yang and yin, servant and the king. He will make you as a king by, what we call our changing our thought process from servant to king, servant to master. You will gain a lot of knowledge because in IIM, they teach you from the root. They nourish the root. They go elaborately. In-depth studies will be conducted. Conceptualization will be 100% pakka. This kind of tuition, honestly, you will not get it anywhere. Anywhere. I have seen, I'm very proud that, we are having this kind of faculty also who can, Kemkaji was there. I'm not belittling anybody. Kemkaji is also from IIT Kanpur.
I am Ahmedabad.
Ahmedabad, sorry, yeah. IIT.
No, I am.
IITians. IIM, sorry, IIM. Yeah, IIM. See, even I have studied 1 year in Indian Institute of Science, and there is a sea of difference and impact in studying in these institutions. If that could be, introduced in all other courses also, our country will progress to a great extent. That is my experience. Friends, I can definitely, why we have chosen this means this will enhance your foundation level, what you call understanding level. So, as he said, Krishnamurti has said, understanding up to 10 semesters will become very easier for you. And, not only in, passing the exam, in treatment, in diagnosis, in prognosis, everything becomes very, very easy. You'll be a very successful therapist. And this is value-added course. By the end of the course, you will be the owner of a big treasure of knowledge. I'm not marketing. I want my people. Why we are planning this and doing it. Whoever attends will be benefited. That much is guaranteed, because this kind of knowledge you will not get it in any other course. Nobody will teach you like this. Even to read on our own, it is very hard. It's not that easy. You see the chapter 1, you'll be knowing how the other 80 chapters will be covered. It is to empower you only we are conducting these classes. And Krishnamurti sir is a professional acupressure, not only therapist, is a very good faculty in our country.